Trial.
I'm Dr. Charles Moak with Allure Medical, and I want to introduce a friend and colleague, Dr. Drew Georgeson. He's a general surgeon with years of experience, over 25 years of experience in general surgery, vascular surgery, and even intensive care work. And in the past 10 years, he's been focusing exclusively on venous disease. And venous disease encompasses varicose veins, and we call ugly legs or discolored legs or ulcered legs. And this is something that's really changed in the past decade, and he's changed with it. He brings his experience from general surgery and vascular surgery into the non-surgical varicose vein and venous disease world, which has been just an amazing transformation over the past 10 years. So I want to introduce Dr. Georgeson. You're going to love this. He's a great guy, and thanks for joining us.
Thanks, Dr. Moak. Appreciate that nice introduction, and welcome to all of you who are tuned in and watching us live. We are excited to present to you a fantastic forum about vein disease. It's a huge spectrum of information, but we try to simplify it. One of the nice things about this discussion is it does simplify how we analyze and diagnose and treat varicose veins, especially when we talk about varicose veins. That means vein disease, or another term, vein insufficiency. And it's something we really specialize very well here at Allure Medical. We've been doing it at all of our vein centers throughout the metropolitan area. We have now 6 locations. And so everybody's pretty close to somewhere you can go to get your legs evaluated for what likely you're experiencing vein disease and don't even know it. And what I'd like to do in today's program is start out with one of our patients who came to us with some atypical presentation, and I'd like her to talk about her experience and how she presented, what she was complaining about, and her experience here at Allure Medical. Michelle, are you on the phone?
I am.
Hi, and could you go to the next slide? And if you could just share with us a little bit about your experience. Tell us why you came in the first place and brought you, and you had one of our vein screenings, which is the first interaction we have with patients, and how you did after that.
Okay. Yes, I did come in for a vein screening because I had been experiencing a lot of pain in my legs, very heavy legs, and very restless at night. So I came in, and after determining based on my symptoms and how my legs looked, they thought I probably had some issues going on. So I went into the ultrasound, and they found out that I had lots of reflux going on in both my calves and my thighs, and I decided I was going to have the ablation done. And I had an incredible experience at Allure. Everybody knew I was very anxious when I came in for the procedure, and they were so great at keeping me calm. And then I realized 45 minutes later, when I was completely done with the procedure, that it was no big deal. So I can honestly say it was quick and it was easy. And I never felt any discomfort or pain or anything like that. So I'm really glad I had it done.
That's great, Michelle. And compared to when you came in, how are your legs feeling now?
I have no issues with my legs. And like I have told so many people, that my response was very quick. So I felt better within a couple of weeks. I could tell a huge difference, especially in the evening when I couldn't wait to sit down and elevate my legs. And I have no problems at all right now. It's been great. I wish I would have had it done sooner, actually.
That's great, Michelle. I really appreciate being on the webinar with us today to share your experience. And what's interesting about Michelle's discussion, she said one thing at the very end that we hear from just about everybody who goes through the experiences: I wish I had this done sooner. Everybody doesn't realize when they come in just how much of an extent vein disease contributes to their day-to-day lifestyle. So what I'd like to do as I get into this presentation, you've heard from Michelle about her experience, is talk about vein disease. And now I know you're going to have some questions, so go ahead and put your questions down in the little chat box. And if during the course of the presentation you know that you want to come in for a vein screen anyway, just type in yes, and one of our representatives will call and give you an appointment. But I'd like to get into our discussion now with varicose veins. And I like this slide. I usually put it up first one because Typically, this is what we get in our office. Patients come in with obvious abnormalities. They see these varicose veins. They're experiencing a lot of pain and discomfort, and everybody thinks that this is a cosmetic procedure and that it would be an out-of-pocket expense to them, and nothing could be further from the truth. Most of these, if not all, are covered by most insurance plans, including Medicare. This patient in particular had literally been brought in by his wife because I think she got tired of looking at these veins like that, and so came to us because all along he kept putting it off because he thought it was just ugly to look at and very cosmetic. Well, what was going on with this gentleman was very severe vein insufficiency or vein reflux. You'll hear me talking about those terms. All means pretty much the same thing, and he had a great treatment and a great result. So what a lot of people don't realize is that veins are an important part of your overall health. We all hear about people and having bad circulation, and most everybody attributes that to arterial blood flow, meaning blood taken from the heart through the arteries down the leg. And yes, that can become diseased and require urgent or significant care, including bypass and stents and what have you. Veins tend to be ignored and have been over the years because if you didn't treat them, the thought was, well, just wear stockings and just have to live with it. But it does affect our circulation, and potentially long-term complications can result. Next. So the significance of varicose veins is very commonly misunderstood, especially amongst the general public, as well as even amongst some of our colleagues who are very focused on your overall health care, including your blood pressure, controlling your diabetes and your arthritis. But vein insufficiency tends to get to the bottom of the list in things to take care of, as well as urgency. And a lot of thinking out there, especially amongst the general public, is that the only way to treat these is by undergoing a vein stripping. That's a term that's been around for 100 years. It's the old-fashioned treatment of removing varicose veins, very painful, requiring hospitalization, very bloody, but we don't do that anymore. We've had some major advances over the last several years that have allowed so many more people to participate in the treatment of vein insufficiency and venous disease. And that's what makes it so exciting, and that's why we're continuing to grow to offer these services to people who need them and have the treatment with little to no downtime and no discomfort. So these advances have become significant, and we like to go and understand that vein disease or vein insufficiency is a medical condition. True venous insufficiency is not cosmetic. There is a medical cause, which I will discuss briefly. There are real symptoms. People come in complaining of so many different problems with their legs, and some of them aren't the typical ones you would expect, but definitely you can relate it back to vein disease. And the more significant part about this is the reason we tend to be more aggressive is there are potential complications if left untreated. If this vein disease is left untreated, it will continue to worsen over time. And we have seen so many patients come to us with what we call ugly leg, advanced vein disease, that and a lot of times these patients have open sores and ulcers and just get moved around from wound care center to wound care center. Well, we offer these treatments and are getting to the cause of that problem, which is vein disease. Our consultations, our diagnostic testing and treatment, again, covered by most insurance. So let's talk briefly about what causes varicose veins. Well, first, I'd like to discuss the risk factors. Now, risk factors mean if you have one of these on the list of risk factors, it means the chance of you getting varicose veins in your lifetime increases. And the number one thing is gender. And I'm sorry, ladies, you're high on the list. You get vein insufficiency much more than men do. A lot of that has to do with hormones, having childbirth, and the walls of the veins are a little weaker in women. The second factor is hereditary, which I think is very significant. Just about everybody that comes in and we ask about hereditary issues, whether their parents had varicose veins or vein disease, most all of them can know somebody in their family that occurred. Obviously, pregnancy has a lot to do with it, especially multiple pregnancies, a lot of pressure on those veins, hormones as well. Being overweight can increase the risk factor. And the last one, standing for prolonged periods. And we see many people from a variety of professions, including people who work in manufacturing, teachers, hairdressers, who are on their feet constantly, waitresses, bartenders. And that in and of itself alone increases the risk of getting vein disease. So what are the direct causes? Well, it's very simple, and I always talk about it as a plumbing problem, and it has to do with these one-way check valves. And these valves become faulty. These are valves in the vein, and I'll illustrate this in a minute. And you combine these abnormal valves with pressure from gravity and the weakness of the vein walls, those veins start to bulge and blood starts to go in the wrong direction. Next. So let's talk about the symptoms. What do people come to us with? Complaining of many different things. These are the most common that you'll see. Leg pain. And it could be pain in the thigh or pain in the calf or even down in the foot. Leg fatigue. At the end of the day, doc, my legs are tired and they're heavy and they're just not like they used to be. Very common for vein disease, especially when you get up in the morning and your legs feel fine, they're light, they're no problem. And as you get on during the course of the day, well into the noon, after lunch, the legs start to feel heavy and tired. Very classic sign of vein disease. Feeling burning, especially where the veins are popping out, if they're popping out. A lot of itching, tenderness, throbbing, discoloration, and swelling, all very common symptoms. It doesn't mean you have to have all of these. We have people that come in with just swelling. And another common symptom people come complaining with are restless legs. And yes, there are people on medications for restless legs, and a lot of those people we have treated and they have been able to come off of those medications. So these are very, very common symptoms. Yours may or may not be on this list, but this is the typical type of situation that we see that focuses us on moving forward to diagnosis and treatment. Now, the severe symptoms, and these are the ones you really want to avoid. These are those complications that can scare you and cause problems, including hospitalization. Spontaneous bleeding. It means the pressure has built up in your vein so much in your leg that it kind of erodes through the skin and just starts bleeding. And we've had people tell us that when they started bleeding, they were in the shower or whatever, and they had to call an ambulance. They thought they were shot or cut themselves and had to go to the emergency room. Skin ulceration, and that's where the skin starts to erode. It becomes very painful and can expand. Thrombophlebitis is a clot formation, an inflamed clot formation in one of these veins, which over time can become quite dangerous. And the last one is cellulitis, which many of you I know have heard that term, but it's nothing more than a skin infection or skin in and around where that vein disease is. Again, that would require hospitalization and intravenous antibiotics. So we're trying to get to you to treat the problem before it gets to these symptoms. So once you come to us with whatever your complaint is that we discussed, we need to make a diagnosis. We need to match what your complaints are, what your findings are, and diagnose it accordingly to say, are the problems that you're having truly due to vein disease? So the easiest test that we have is an ultrasound. And I'm sure many of you have had ultrasounds before. Very simple, very easy. We interpret the results right away. We have ultrasound machines as well as ultrasound technicians in all our offices that when you come in for that screening, we can get you in and get that answer for you right away. And we map out all the veins of your leg and locate the areas where those bad valves are we're talking about. We're looking for abnormal flow patterns in the leg. Next. So here's an example of the vein. Healthy vein there you see has the valve in the middle that's closed, and it opens and closes, and it keeps the blood from going down to gravity. So imagine that the lower part of the slide is the foot, the upper part of the slide is the head. And so blood is only supposed to go from the foot up to the head. And in between heartbeats, those valves were closed and don't allow blood to go down. If you see on the diseased vein side, those valves are broken and they're not closing. So when you're standing, blood is actually going in the wrong direction and lower. And the longer you stand, more and more blood and fluid go down the leg. It's as simple as that, faulty valves. Next. So what we do is, this is a diagram of your leg with the veins of the leg, and we look at the locations that we find are very typical for those diseased and broken valves, because that's the cause of the problem. The result of the problem are your bulging veins, because if you've got a lot of blood and fluid going down the leg, it has nowhere to go but out towards the skin to dilate those veins, and that's why you start noticing those bulging veins. Next. So here's an example of one of our technicians doing an ultrasound. We have, where you're lying down as well as sitting up a bit, so we can determine those flow patterns. It's a very easy exam. We have you put on shorts. It takes about 45 minutes, but we interpret the results right then and there for you, and then lay out a treatment plan. And here's what we're looking for on that test. Again, we're looking for vein reflux, how much blood is going in the wrong direction, as well as the diameter of the vein, meaning how large has that vein become. And those measurements determine how we can get authorization to have that treatment recommended. So let's talk about treatments. And everybody always talks about the non-surgical treatment, and that is the use of compression stockings. Now, many of you have had the experience of wearing compression stockings, and most of you, if you've complained to your physician about your swelling or your uncomfortable legs or discomfort of the veins, the immediate thing is wear compression stockings. And the whole idea is a lot of firm compression on the lower part of the leg, and as the leg goes up, the stocking goes up, less and less compression, helping to facilitate blood flow from low to high. This is a good treatment, but we only look at it as a Band-Aid, because ultimately it does nothing to improve the problem long term. Add to the fact that wearing stockings in the middle of summer here in the Detroit area is not a fun proposition. And getting these on and getting them off is also quite a feat. So most of the time we see patients who've already had the stocking and are looking to go to the next step. So this is where vein ablation has come in, radio frequency or laser vein. Go ahead. And the difference is the type of energy that we use to shut down that vein. Years back, the stripping procedure would surgically remove the vein that had the bad valves. We no longer do that. We close the vein off using laser energy or radio frequency energy. And in this slide here, I'll go back, you can see the laser light through the skin, and that's done under a little local anesthetic. Next. Radio frequency ablation is a different type of energy, same principle. It goes into the vein, and when we turn the energy on, it shuts the vein down. It causes it to cauterize down. So here's an example. And you see on that diagram of the leg, you see the great saphenous vein. That's the main vein that has the bad valves notoriously. And in those three little vein pictures, you see the one on the left, the catheter is in the vein that we put in position there. We watch that on the ultrasound. Once we turn that on, it heats the vein, and as we draw that catheter back, it closes the vein. Next. Here's an example where we do the procedure. There's a table there, ultrasound machine, and a couple of, there's a pump there with an IV that we use to help secure that catheter around the vein, and we have the monitors to see our imaging. Next. Here's an example of me doing the procedure on a patient. She's actually sleeping, resting comfortably. I'm there with my ultrasound technician and my medical assistant helping me do that procedure, and it takes all of maybe 10 minutes to do the ablation. Here's a close-up of what that looks like as that catheter goes through the skin. We use a lot of local anesthetics, so it's really, you don't really feel any part of that. You do not feel the laser itself inside the vein or when we turn it on. Here's another diagram from a little farther back. Same principle. Rather than removing that vein, which requires surgery, we're putting that catheter up into that vein, and once it's in place, we turn on the heat energy and it shuts down that vein. So now blood can no longer go down that vein, and it goes through all the other normal channels. Another more detailed example of the same thing I'm talking about as it completely comes down through the vein. Additional treatments, once those are done to help keep the problem from coming back, we treat the smaller veins that have reflux by doing microfoam sclerotherapy. Again, covered by your insurance as part of the treatment, where we identify those smaller branches with the ultrasound and inject a foaming agent that causes an irritation in that vein and shuts it down. This is a very simple procedure, and there's an example of the foaming agent that we use. This is a procedure that takes maybe 5 or 10 minutes in the office and is part of the treatment. Again, this is an example of that catheter going inside the vein and injecting that foam and selectively shutting that vein down while all the other normal veins are running normal blood flow. So here's some examples of a patient. I'm going to kind of go through some before and afters. That's what everybody's always usually interested in seeing. And the diagram or the picture on the left shows an obvious bulging varicose vein. And the initial treatment for this gentleman was not just simply removing that vein. It was removing or closing off ablation of the vein that was feeding it, and then going in and injecting and shutting that vein down. And we do this with phlebectomy. We remove the vein by, in the office with a little procedure, make a tiny little bit of Novocaine in the skin, make a small opening, and retrieve that vein. Very simple, not painful, and the cosmetic result is excellent. So here's some more results. On that diagram on the left, you see this patient who's had a large varicose vein in her calf area. And then on the right, this is several weeks later, it's completely gone. But the important thing to remember is that there's no, that vein was treated by first taking care of the saphenous vein above it. Next slide. Another example of a before and after. And one thing I'd like to display on this one, the diagram on the left, you notice the orange color on the lower part of the legs. That's a long-term complication of chronic vein disease. It's a very common finding in somebody who's got vein disease, and that's the result of blood leaking out of the blood vessels because they're under pressure and moving out towards the skin, and it's iron deposits in the skin. Now, once you remove that pressure and treat the underlying cause, over time, we have seen that improve, but it takes a long time for that to happen. Another obvious before and after of treatment of varicose veins. Next. Now, this is one of our patients. The top 3 are the befores, and the lower 3 are the afters. This patient came in complaining of severe pain, cramping, and swelling, and had a lot of those bulging varicosities. And again, the temptation is, we'll just go ahead and remove those big bulgy veins. But if we do that, the problem will keep recurring. What we have to do is go in and treat the source of the problem by doing the ablation first, and then whatever veins don't fade away, we go ahead and remove through microphlebectomy. Again, another before and after. This is a patient who had a lot of pain and swelling on that right leg, as you can see in that left picture, and the result is excellent. The swelling went down. Obviously, the veins are gone. The leg looks a lot better, but more importantly, the leg feels better, and the patient is now enjoying so many more things and on the outdoors because that pain, that leg isn't keeping them down. Another good before and after, same similar situation, large varicose veins. Treat the source first, and then take care of the varicosities next. Now, this is an example of one of our patients that come in with an advanced complication, what we call our ugly leg. This is a patient who's been suffering for years of vein insufficiency, was going from wound care center to wound care center because he kept getting these recurrent skin ulcers. They're very painful. They continue to erode the skin, and it's a real difficult life. He was in a wheelchair, really couldn't move around because this kept him down. So it took a while, but we went and treated the underlying cause of his reflux with a combination of laser treatments as well as injections, and his total quality of life has changed. He's much more active now. He gets around. He's so happy with the results of what he went through. And these are the types of complications that can occur long-term if left ignored. These are an example of spider veins, and the only reason I bring that up is spider veins are considered cosmetic. They are not covered by insurance. Sometimes we see patients with just spider veins. And I caution everybody, well, those spider veins came from somewhere, so we also get ultrasounds on somebody with a lot of spider veins, because Once we treat them, we want to know they're not going to come back. And if there's an underlying reflux, you're just wasting time by treating them and not taking care of the underlying reflux. Next. Again, some more examples of using sclerotherapy injections to treat some of those spider veins. Next. So when you schedule your appointment and you've seen the webinar, you'll get a complimentary pair of stockings. We want you to come on in. If you're interested in making an appointment, type yes in your chat board, and it would have you come in for a screening exam. You'll see one of our providers at any one of our locations. And if we think it's important that you go ahead and get a ultrasound, then we have ultrasound technicians and machines right on the premises for us to do that. Next. So Katie's going to let me know if we have any live questions while during the course of the discussion.
We sure do. So our first question is, how many treatments would I need after my leg ultrasound is completed?
So the question is, how many treatments are needed? And that varies. But we do is on the ultrasound identify how many veins have bad valves. Typically, it's about 4 of the main veins underneath the surface of the skin have the bad valves. So on average, each patient would receive 4 separate vein ablations, 3 to 4 separate vein ablations. These are separate appointments, but they're quick. There's no downtime. You can come at your lunch hour and go right back to work. We encourage you to resume all your regular activities right after the procedure. Once those ablations are done, then we reevaluate with another ultrasound to see if there are any remaining smaller branches that potentially could require additional treatment, which would be microfoam sclerotherapy.
Are these treatments painful?
Are the treatments painful? For the most part, they are not. Typically, patients come in very nervous, not sure what to expect, and they leave thinking that was nothing what they were worried about. We do use local anesthetic, the comparable to Novocaine that the dentist would use to numb up that area where that catheter goes in. But for the most part, it's very well tolerated, and people keep coming back for their follow-up appointments without any difficulty.
I have a job where I'm on my feet all day. Can I go right back to work after the treatment?
So the question is, the patient has a job where they're on their feet all day. Can they go back to work right after treatment? And the answer to that is absolutely yes. We encourage and want you to be up and about, stay active, drink plenty of water. We want that blood flow going through that leg. Having this treatment, going home and laying down is the last thing we want to have you do. Any other questions, Katie?
When I come in for my free vein consult, can I have the ultrasound done on the same day?
So when you come in for your vein consult, can you have the ultrasound done on the same day? Absolutely. We really encourage you when you make that screening appointment to allow some time. The screening appointment only takes about 10-15 minutes and the ultrasound about 45 minutes, but we definitely want to get you diagnosed so we can start your treatment right away. And the nice part about it, once you start your treatment, within 2 to 4 weeks, sometimes up to 6 weeks, you'll start noticing how much better your legs feel.
Does my insurance pay for the ultrasound and vein treatment?
So the question is, what does insurance pay for? Does it pay for the ultrasound and the treatment? Well, everybody has different types of copays and deductibles, and we try to do our best to make sure we know that information ahead of time. It's something you should also come knowing ahead of time. But yes, if there's medical necessity for doing the ultrasound as well as the treatments, insurance will cover those treatments and the ultrasound. Okay.
Do you offer vein treatments at all of your locations?
Do we offer vein treatments at all of our locations? Absolutely, yes. If the Metro Detroit area, we have 6 locations, soon to be 7 opening up in West Bloomfield. We have Clarkston and Beverly Hills, Southgate, Shelby Township, and Livonia. All of these locations should be well within a 5 or 10 minute drive of most of the Detroit area. So we encourage you to come on in, have your vein screen. If you're watching us on the webinar, just type in yes on your chat and one of our representatives will get back to you. I want to thank you for your time and attention. we look forward to seeing you in the very near future at one of our numerous locations. Thank you.